Portea.
In the previous video, we learnt about quarantine and who should be quarantined. In this video, we will learn how to monitor the patient and understand the protocols to be followed in isolation. Let's discuss on monitoring the patient. Step 1. Do health checks every morning and every night or any time you feel that you might have a fever. Take your temperature and or that of family members who are being monitored and cannot do so themselves. In addition to fever, be alert for any symptoms of COVID-19, including cough or shortness of breath. Write your temperature and other symptoms in the log. Family members who are not being monitored do not need to record symptoms. Step 2. If you have fever, cough or shortness of breath, do not go out in public. Call the healthcare provider. Tell them you are under COVID-19 quarantine. Seek medical advice. Call ahead before you go to a doctor's office or emergency room. Tell them you are under COVID-19 quarantine and about your symptoms and guidance received from the health department. Avoid contact with others. Reminder, do not take public transportation, taxis or ride shares. Cover your mouth and nose with a tissue or your sleeve, not your hands, when coughing or sneezing. Wash your hands often with soap and water for at least 20 seconds to avoid spreading the virus to others. If soap and water are not readily available, you can use an alcohol-based hand sanitizer that contains 60 to 95% alcohol. Always wash hands with soap and water if hands are visibly dirty. So far, we have learnt on monitoring the patient. Now, let's understand isolation protocols. 1. Isolate the affected person. They should be in a separate room. It is important to have good air circulation in the room. For example, air conditioning or keeping a window open. 2. The patient should avoid all contact with older people, pregnant women or anyone with compromised immunity. 3. The patient should always wear a mask and keep at least 6 feet away if the caregiver has to come into the room. Keep these interactions as brief as possible. 4. If possible, the patient should have a separate bathroom. If this is not possible, then all other unaffected family members should use caution when using shared facilities. Use diluted bleach to wipe down door handles, toilet seat and handles, sinks, etc. Each time the patient uses the bathroom, the patient should have their own toilet roll and towels which should be kept separately. 5. The affected person should eat in their room and if possible use disposable plates, knives and forks. If not, use gloves when washing their plates, spoons, knives and forks. Use diluted bleach and rinse well. So far, we have seen on isolation protocols. Let's summarize what we learnt in this video. We learnt on monitoring the patient and isolation protocols during quarantine period. Hope the session was very informative and you have understood. If you have any queries, please watch the video again. Thank you.
Portea, heal at home.